want to begin by sharing a little bit about how I became interested in the topic of helping children through the pandemic. When we began to come back to worship, even virtually, right as soon as the pandemic began, we as a Virginia United Methodist Church were under the guidelines of the Technical Assistance Manual of the United Methodist Church. And right away, things changed for us. We started having worship with only 10 people in the sanctuary at any given time. We were very careful about the number of musicians we had because Methodists like to sing. That was a real challenge for us. But I think the thing that I noticed first, and the part that to me was, made worship very different, was that at that time, we weren't allowed to have any children come together for worship. And I understand the reasons for that. But it really was emotionally for me difficult to experience worship without seeing any children. Well, we're glad that our preschool has been able to be a pilot program and open again. And we do what we can outside, socially distanced, reading stories to children and so forth. But that experience that I've had caused me to really become interested and wonder how I can be of more help to children and families during this time, because it is quite a difficult time for them. And so I started thinking about my resources, and I remembered that I had a good friend from college days who had become a pediatrician. And I have come to learn since then, not only did Dr. Drew Baker become a pediatrician, he attended and graduated from the Medical College of Virginia. After some time, Drew returned to school again and received his Master's of Divinity from Emory University, the Candler School of Theology. And if that's not enough, Drew became an ordained Episcopal priest and is now teaching pediatric medicine at Eastern Carolina University. So we're very pleased to have Dr. Baker. And I want to welcome you tonight, Drew. It's really great to see you again. I'm looking forward to hearing what you might be able to share with us about children in this pandemic.
Absolutely.
Well, let me begin with a prayer, and then Dr. Baker will begin with a presentation. I want to tell you that if you have any questions tonight at any time, please enter them into the chat, and I'll monitor the chat, and we'll rephrase the questions for Dr. Baker when his presentation is over. So you can do that at any time. I also have some questions tonight that were developed by members of our church, our children's ministry, and also people who have been involved in the preschool at Pender. So let's begin this evening with a prayer. Would you please join me in prayer? God, we give you thanks for the gifts and graces of doctors and nurses and those who have been shaped by you uniquely in such a way that they have gifts in science and help us understand more fully how to respond to the times in which we live. So we ask that you build a hedge of protection around us tonight, this webinar that we are conducting together. Protect us, watch over us, and may what we share together this evening be fruitful and be of encouragement to others and to help them during this difficult time. We offer these prayers tonight in the name of our Lord Christ. Amen.
Amen.
Welcome, Drew.
Well, it's good to be with you all tonight and to connect back home to Virginia and to United Methodist Church. It is true, I've known the Reverend Will White since our college days at Hampden-Sydney and some trips in college, even to visit his sister Ellen in New Orleans. I'll let him tell you more about that trip sometime. I never imagined when he left for divinity school and I left for medical school that our paths would cross again during his first church assignment at Bon Air United Methodist Church in Richmond, Virginia. And yes, it's also true, I did introduce Will and Donna. I think their first date was a double date with me and my girlfriend at the time. And all these years later, how incredible is it that we have reconnected through this opportunity to be together with you tonight, at least virtually on this Pender Talk. I have to be honest, I'm not sure that I'm going to fulfill the 30-minute allotted time that Will gave me to speak this evening. I grew up not too far from you all at Pender in Vienna, Virginia, at Wesley United Methodist Church. My dad, who was a Fairfax County police officer at the Chantilly District Station for many, many years, was infamous in that he was known to get up and walk out of church on Sundays at noon if it was a Washington football Sunday so that he wouldn't miss the 12:19 kickoff. So for many years, Dad would time my sermons on Saturday nights to make sure that I kept under his personal time limit for speaking engagements, and that was 10 minutes. So no pressure this coming Sunday, Will. I don't know that anyone is going to be timing you, but I think tonight we'll have plenty of times left over for some visiting and some questions. Last year, almost exactly a year ago, in February, I was in Costa Rica for a one-week medical mission trip with One World Health out of Charleston, South Carolina. I remember watching the news at breakfast about this new virus out of China and cruise ships circling off the coast of California. It seemed so far away in Central America, didn't really have any direct effect on our work in San Jose, and we were able to travel home without any difficulty. It was the next month in March. I had a long-awaited vacation planned for 1 week in Mexico. It was a pretty fancy trip for me. It was all-inclusive, adult only, not the type of trip that I normally take, but I've been planning it for many months. And the night before I was to fly out, the border between Mexico and the US was closed. So my vacation was canceled and I was back at East Carolina University Pediatrics and Clinic the next Monday. And that was the day everything changed for me. That was the day there were no more routine in-person doctor visits. That was the day that we started having trouble getting PPE or personal protective equipment for physicians and staff. That was the day we started caring for patients virtually. And it all changed overnight. Maybe you might remember when the pandemic became real for you and your family. Maybe it was when everyone was asked to stay home from school or from work, or when churches couldn't be open on Sunday mornings, or even when a family member or friend became sick with COVID. My initial response to the pandemic was frustration over not knowing how to be the most useful. Somehow, meaning it was my boss's idea, I ended up becoming the spokesperson for the School of Medicine at East Carolina for all things related to the COVID pandemic and children. Had the opportunity to write for the local newspaper, to speak on local radio, even do some television spots. And if you don't mind, I thought that I might read you an article that I wrote for the Daily Reflector in Greenville. The letter was from March 28th, 2020. And Will, I think you have this letter, if you might want to put it up on the screen for people that would choose to see it visually rather than listen to it. So I'm hoping Will might be able to find that for us. Okay. Any luck, Will?
I'm finding it, Drew. Let's see. This is...
It's dated March 28th, 2020.
Okay.
And if you can't find it, I'll just read it.
Hang on, I've got it. Should be bringing it up in just a second.
Thanks for the tech help, Will.
There we go. All right. Should start seeing it very soon. Can we see it? Can you see it, Mary? Drew?
I don't see
I can
it.
see, yes, I can see it.
Perfect. So I'll start reading for those of you that would rather listen than to read along. For those who care for and love our children and young adults, how do you even begin a conversation with young people about the COVID-19 pandemic? Where do you go for accurate information to share with others? How do you go on with daily life in the midst of restrictions and loss and uncertainty? We are bombarded as a society with access to information and misinformation 24 hours a day through televisions and newspapers, the internet and social media. There are two reasons communication is necessary: information and reassurance. As adults, we must be a filter to provide accurate, relevant, age-appropriate information for our youth. Consider asking what a child has heard or is thinking about the coronavirus. Use easy to understand and direct language. Most children may not need or want to know daily statistics on those who are sick or have died. Many children might have their own questions about things that are specific just to them. Remember, if you're asked a question that you're unsure of the answer, then consider looking it up on a reliable source like the Centers for Disease Control or the American Academy of Pediatrics or healthychildren.org. Just because we don't know everything about the coronavirus doesn't mean that we don't know anything. And we continue to learn more each day. Stay informed through focused pediatric attention to trusted sources. Consider limiting media exposure both for your children and yourselves. Offer an honest message of hope. It is not life as normal, but it is life as it is now. Try to establish a predictable new routine for your children and for yourselves. Make sure there is time for learning and resting and recreation, but also make sure that in this time there's something that might be new or different for your family. Maybe cooking a meal together, or reading a special book out loud every day, or learning a new skill or hobby or language, journaling or writing about current experiences and how it makes you feel. And allow time for fun. Humor, joking, singing, dancing are all ways that we can express ourselves. And always be open to the unexpected. Finally, don't pretend everything is all right. Let your children see that concerns and fears are normal responses to stressful situations. Remind your children what we do not know that will keep us, what we do know that will keep us and others safe. And what we do know is good hand washing, coughing and sneezing into our elbows, social distancing, wearing masks, and staying home. Provide reassurance and hope, and remind our young people that what we are learning about ourselves and our society during this time of uncertainty and concern will help us to be better people and be better to each other. Reading this letter almost a year later makes me realize what a long and difficult year it has been for all of us. I don't think that any of us imagined last February or March that our lives would continue to have been so disrupted by COVID a year later. Some of the challenges children and young people have faced and continue to face during the COVID-19 pandemic relate to changes in their daily routines, having to be physically distant from their families and friends and their neighbors and from worship communities. They continue to face breaks in continuity of learning to deal with virtual versus in-person learning and having technology access and connectivity issues that make learning difficult. They continue to be faced with breaks in continuity of healthcare, missed well child visits, vaccinations, limited access to mental, speech, physical, and occupational therapy, and even dental care. And missed significant life events, vacations, birthdays, anniversaries, graduations, and even grief and funerals. And for many kids, there's been a loss of security and safety. They now face both housing and food insecurity, increased exposure to violence and online harm, and threat of physical illness and uncertainty for the future. I thought it might be helpful to look at some of the most frequently asked questions, not about the science of COVID, but about dealing with a pandemic in children. One of the questions I get often on TV programs or radio shows is, how do I communicate with my children about the disease without scaring them and according to their developmental stages and ages? Simply use direct and easy language that they can understand, and provide them with basic information without unnecessary details or statistics. Consider asking them what they've heard, and then asking them what questions they might have. Another question that I hear frequently is, my child thinks that she has the virus or he has the virus every time she sneezes or coughs. How do I calm her fears? First of all, as adults, as caregivers, we have to set an example and model behavior. And we have to remain calm ourselves, even when we don't feel very calm. Reassurance is the key when it comes to this. And remind your children that a lot of things, aside from the coronavirus, can make us cough and sneeze and feel bad. But there are medical providers who care for children that are there for families to help what tests and medicines might be needed to help kids feel better and to stay healthy. Another question that I've been asked are, what are some of the ways adults can share information on how to stay healthy, such as hand washing and wearing a mask and social distancing, in ways that kids can understand? I think the best way is not just to tell them, but to show them. For each of us all the time, whether we're at home or at work or at our churches or places that we shop, to model good practices that will keep you safe and teach your children to be safe at the same time. And maybe, if it's possible, make things fun rather than a chore or punishment for forgetting. I believe some of you from the preschool and others at Pender might have submitted some questions. I'm looking forward to the chance at the end of our time together to discuss those, any others that you might have to ask.
Well, Drew, can I follow up on some of those questions? So,
Sure.
So talking about how to talk directly using simple language. Let's give an example. Let's pretend that that you're talking to a 5-year-old or a 5-year-old and trying to explain why someone is in isolation. How would you approach that? I'm curious. I know that you've probably been doing a lot of that. So
I think we just try to speak to them clearly and give them reassurance, and not use big words or make it too complicated or scary. That way we have to be calm ourselves, saying, Miss Francis from church is sick with the virus, and we've been really worried about her. So she's going to be home taking very good care of herself for the next 10 days. So we need to think good thoughts for her and say our prayers for her every night. And if there's something that we might be able to do for her that's nice that we could leave on her doorstep, like a card or cookies or food, maybe we could do that to help her get better and to make her feel loved.
That's really good, Drew. And so that's great. Simple language, just explaining, why that would be the case. And then showing kids how to stay healthy. So you go to the sink and you start to wash your hands and say, do you notice I'm doing this? How do you engage a child to do that?
We have to come up with your family song, Will. Of course,
okay.
You're going to sing every time you wash your hands. So I know some parents do that with brushing the teeth.
Okay.
That they make their kids hum happy birthday.
Happy birthday. Make sure that they brush long enough, right?
Right. So I think lots of families have come up with a pandemic song that's pretty upbeat. Mm-hmm. Every time they go to put the hand sanitizer on the fronts and backs of their hands, or every time they wash with soap and water, they sing that song and try to make it something that's pleasant and not too frightening.
You were talking about trying to make things fun. I've seen some interesting masks lately, some for children that are really cute with faces on them and things like that. That I think that a kid would be much more interested in putting on a mask that makes him look a little like a cartoon character, as opposed to, someone who's at a cold, scary hospital. For kids, I guess that probably does feel a little cold and scary. You're used to that. So what are some things? How do you put the fun in a pandemic? What are some ideas that you might have, Drew, there?
I think trying to set a new routine and make sure, if you're doing virtual learning at home, that there's time for school and learning, and there's also time for fun. Mm-hmm. And I think when we were locked at home with our families for so long, For many of us, that was a great opportunity to spend time with our kids and our loved ones that we may never get back again. And I had a friend that started a candle making company during the pandemic. So they used that time at home to develop hobbies that actually became a business that's going to help support their family.
Try to do something different, something new.
Right. And I think I've been so amazed at the things families teach me that they do to keep their kids entertained. When it was cold outside last year, when the weather's been bad and the kids couldn't get outside to exercise, our kids like to use YouTube to waste time. But what about if you use YouTube to learn Irish dancing or Zumba or yoga? So I'm always asking my kids in the clinic, what's something you've learned during the pandemic and how have you learned it? And the kids have learned really cool stuff on video and on social media, even TikTok. So some of the things that sometimes we worry about our kids using too much or in ways that aren't healthy, we've been able to turn around and use them for good.
So having them maybe try to learn a dance step with mom and dad or something on YouTube, something like
exactly
that. Fun.
Yeah.
I know it gets to be a bit of a struggle. You mentioned how fun it was. The first 2 weeks, it was great. I think for a lot of people, they felt like they were doing things, but as doing things that they hadn't had a chance to do, maybe working around the house and things like that. But as the pandemic continues and goes on, it gets harder. So try to keep it fresh. Learn a dance step on YouTube, maybe cooking or something like that as a family, doing something like that to have the kids help with that.
I know one of the things that a lot of my families did that I thought was super cool is that a lot of the museums around the world had free virtual admission. So you could walk through the MoMA in New York or the Louvre in Paris. And,
oh, wow.
Yeah. So there was fun ways that kids could learn and also feel like they were getting to travel outside of their spaces. And I believe some places are still doing that.
So a virtual trip to somewhere
exactly
to go visit. That sounds like a lot of fun. So these are some things, the movement, staying in shape, that is so hard. I mean, I'm a gym guy, but I'm trying to keep my congregation safe and myself safe as well. And I'm just not quite ready to walk back in there yet. So what kinds of things for kids any other things that you can suggest for kids maybe to help them stay in shape?
So I have a super fun story that's a little bit off topic, but I'm so proud. When the pandemic hit, I couldn't go to the gym either. Well, so I started accumulating some weightlifting equipment here in the house to use, and had a friend who also wanted to do that. We started in, the end of July or August, and he was over 300 pounds when we started working out.
Oh my gosh.
He's now at 214 pounds.
Okay.
So during the pandemic, with no access to the gym and just a home gym and an exercise bike, he's lost almost 100 pounds. So I just think it's interesting when people are given the opportunity to be creative.
Yes.
The things that they come up with.
People are coming up with, that's amazing. So Gal lost 100 pounds weightlifting at home.
Pounds. Yeah.
But the routines that kids are in, you've been on television. You sent me some of the questions that the TV people have asked you, and I maybe ask some of them. Like after you've been with the kids all week, so how do you handle the weekends? What do you do differently to make it seem, keep them on a schedule, and how do you make that different from what they've been doing so far?
I think trying to keep schoolwork for during the week and then the weekends for fun. And like you said, it has to be something new and fresh or different. And in the middle of a pandemic, the adults have to come up with things that are new or fresh or different. So I think that that's the challenge for us as adults, but recognizing that we need those changes as well. We need the weekends to put away our cell phones and our tablets and our laptops and spend time with our families and maybe work on a puzzle. Maybe read Harry Potter out loud together as a family. Every night.
So have a work week, and have the kids stay on their schedule to do their homework during the week, and then make the weekend different and try to make it as fun as you can in the situation that we're in. So schedule's a big deal. And some of the parents, I'm sure, are worried about like how to get their kids ready to go back. Any advice? I know that in the schools in our area, some of them are starting to go back. What can they do to help prepare their children?
I think it might be helpful just to explain how things might look or be differently at school and what the expectations might be. Whether it's the fact that everyone will be wearing masks or that the desks will be separated and they won't have the same sort of lunchtime or recess or gym time, and just let them know in advance what the changes are going to be so that they can anticipate that and have time to prepare for it. And then once again, just giving them reassurance that everything is going to be okay and that their teachers are there to help keep them safe and to teach them and to protect them.
That's great, Drew. So, the way I'd phrase it, just hearing what you said, sort of paint a mental picture, tell them what to expect. From the moment they walk in the door, all your friends are going to be there. You may not recognize them because they're wearing masks, right? And that your desks are going to be spread out everywhere. You're going to be asked to socially distance. Those are some of the things. So they're going to have to do that. What are some other kinds of things, Drew, that schools are doing that those children need to be prepared for as well? I know they're going to be spread out. What else is going on in the schools right now from what you've observed?
One of the things that I wanted to talk about, and it kind of goes along with this, is that the CDC just released new guidelines last week on the 16th about how they were going to reopen schools. And this is kind of the latest that's come out about COVID from the government. And it relates to elementary schools and high schools. And they said that schools should be the last setting to close when all other measures have been employed to try to cut down on the spread of COVID, and the first to reopen, and that they should be prioritized for reopening. And that in-person instruction should be prioritized over extracurricular activities, including sports and activities. There's also been some really interesting data that says younger children, like elementary school children, might have less risk of in-school transmission of COVID than older school students in middle school and high school. Hopefully the schools are going to be giving families some input, particularly families who have members with severe illnesses or special healthcare needs. And they will be given options to learn virtually, regardless of what everyone else is doing. There might also be some use of cohorting or podding of students, words that we're becoming familiar with, where certain students attend school certain days of the week. And that might be something new for them to have to think about, that they may be with a different group of friends on school property and in classrooms on different days. One of the things that I'm really excited about is that schools are going to get some of our special education students back to school as soon as possible. Those students that really need their physical therapy and occupational therapy and speech and mental health care and counseling. And they're going to be prioritized to get back in school so they can receive the services they've been missing with virtual learning.
So if parents have kids that have special needs, they should hear from the school, but they should probably also proactively ask if their children fit into a certain category.
And if they're not receiving the services that they need because school has been virtual, I just urge the parents to reach out to their healthcare providers, to their pediatricians and family doctors, and ask them to arrange for additional outside therapy if the family's comfortable with that, that can occur outside of school when school's not in session.
So outside, if the services aren't going to be able to be offered initially. Well, you mentioned potting the kids together. Now, how do I know what families are doing? What does that look like in a school? I bet your families up there can tell me what it looks like in Fairfax County. Okay.
Because I think it looks differently in every school situation, whether or not that's O'Connell Catholic School or the Fairfax County school system, about whether or not children are attending in person 3 days a week, and then other kids are attending 2 days a week, and that switches off. Whether it's a hybrid, that's been very popular, of course, over many months, where Some kids will attend school for a week or two and then have 1 or 2 weeks of virtual at-home learning. But I think the thought is trying to keep groups of children together in smaller groups where they're exposed to less people. And I think some families have also been doing that, where after the first 2 or 3 months of the pandemic, they've said, listen, our kids need to have some interaction with other children. So we have a family that lives down the street, and we know the parents work at home, and we know that they believe in masking and hand washing. We know they're not going out to restaurants to eat. So we're going to let our children play with them and have a very open, honest conversation that if either group does something that could put the other at risk, that they would tell each other. And just make that commitment to smaller groups of people with less exposure to less people.
Well, that sounds like a good advice to their families are already probably potting among families that they feel comfortable having their children play with, and to keep the communication open and honest, and let everybody know what your health status is. And then, in reassuring people, you've been talking about that, how important that is to reassure children. And it's a little difficult, isn't it, when we don't really know exactly when all this is going to end. Sometimes we don't know what's next. I think here, let me give it a try, and then you can tell me what we can add to this. I might say to a child in this situation that, there are lots of people out there who care about you. Your mom and your dad care about you. Your family doctor, your teachers do, and we're all looking out for you, and we want to keep you well. We don't know everything that we're going to encounter, but here's some things that we do. Here's some things that we know that you need to get ready for as you go back to school. Everybody's going to be wearing a mask. You're going to be asked to spread out. You're going to be asked to be in groups that are maybe a little different. And, mom and dad are going to do their very best to look out for you. And we want what's best for you. So, to reassure, what else can you say? What else would you say, Drew?
No, I think that what you said was lovely and was spot on. I think something, though, that's just as important as trying to prepare them to what's going to be different is to give them opportunities to express their feelings, to ask questions.
Their fears.
Yeah, exactly. And to not downplay those fears. And sometimes as adults, sometimes as pastors, we try to fix things and make everything all right, versus just letting people say what they need to say and sit there with them. So I think it's really important. I remember coming home from school in Vienna and having my mom say, "So how were things today at school?" And I know that sounds kind of old fashioned and leave it to Beaver. But I think that now is a really important time with our kids going back to school that we do that again. How were things today at school? How are you feeling? How are your friends? And give them a chance to talk about that and to listen. And also to allow them to be the ones to ask the questions. So I think that the pandemic is going to give us an opportunity to become better communicators and better listeners.
So listening to a child, asking the question, how was your day? And then just sit back and maybe not say anything until that child has a chance to open up. And if they're silent, maybe wait a little longer. And then the follow-up. Hey, really, how was it? What was different? And then their fears, and to encourage them to tell you what it is that they're afraid of, and try to help them if it's a rational fear or if it's irrational. Because I imagine some of the fears that children have are irrational. Lots of television, and it seems like it's overwhelming, I guess. But to also tell them how important it is to be careful right now. So that's a challenging job for parents. And God forbid if the child starts to experience symptoms, what do you do? I had a little cold. I think I told you. Well, actually, you had COVID, so you did. Well, what did that feel like? That might be helpful to let people know. What are the symptoms like when you go through that?
It was a little different for me. I had both of my COVID vaccines in January, and I was having an outpatient surgical procedure and had to have my nose swabbed before the procedure, and they called me the day before and told me my procedure had been canceled. And I said, "Oh no, what's wrong with the doctor?" And they said, "Nothing's wrong with the doctor. You have COVID." So that's how I found out I had COVID. I had no symptoms when I was diagnosed. It's pretty unusual to have both doses of the vaccine and test positive, but they're really hoping that those of us that have the vaccine, or when all of us have the opportunity to have the vaccine, that even if we do get sick, that it'll be a milder case of the disease with less complications. And I've been back to work for 4 weeks now, and I'm feeling pretty well. Back to lifting in the home gym and doing some YouTube yoga and getting some running in on the elliptical machine. So,
well, you're a busy guy, Drew. You're always on to the next thing. I had a situation where I was exposed to someone and then had a cold, some kind of a cold or virus, not COVID related. I went through tests, and what I did, I was very honest with everyone about what was going on with me, so that they knew if they needed to be checked. I had 2 tests that tested negative. You don't want to get the kind of attention you get when you drive into one of those places that, I went to a clinic to get my COVID test, and I was running a little fever and coughing a little bit. And let's just say they were taking no chances when they administered that second test, given those little symptoms. But I think you're talking about, noticing the symptoms and addressing them right away. Communicating with anybody you've had contact with is so important. And in your case, you're very fortunate that you had the vaccine, and maybe that helps you from getting it, a worse set of circumstances than actually happened. So that sounds like we're all waiting for our vaccines around here. A lot of us are still waiting. Some have already gotten them. So,
Will, you were asking about symptoms. I think it's important for families to know that children often have different symptoms than adults. In adults, we know to look for fever over 100.4 and cough and runny nose, but kids can be much more varied. A lot of times it can be something simple like a sore throat or a headache, or even pink eye. I've seen some kids with a little pink eye that have tested positive for COVID. And I think it's just important that if you think your child has been exposed or you've been exposed, to be tested. If you haven't been tested for COVID, I've been tested several times. It's really nothing like people talk to you about. It's really not that big of a deal. Many of you have had flu testing over the last 20 years, and there's a little swab in your nose. It's pretty much the exact same test. It's either at the top of your nose or the back of your nose. So it's almost identical to current flu test or previous year's flu testing. So it's really, really not that different. Hey, Will, you said something that really resonated with me about telling people that you were exposed to COVID. I've been shocked that there's been a stigma about having COVID or being exposed to COVID. And when I was diagnosed, I called the head of the lab up and said, there's got to be a mistake. I'm the most safe person ever. I wear my glasses or wear my mask. I wear my gloves. I use my hand sanitizer. I have my vaccines. It can't be me. That's impossible. I've had the vaccine. So I was very much in denial of that. And then I was embarrassed. And I thought, I wonder what people at work are going to think I did wrong to get COVID. Like, did I not wear a mask or a face shield when I was out in a car seeing somebody with COVID symptoms? Or did I forget to wash my hands in between patients? And I've heard lots of people that have the disease talk about that there's some shame involved about getting COVID. And I feel that that's just so sad. When I was diagnosed with COVID, I couldn't participate in our church services that we've been streaming. And so I got to watch church from home. So for a year, I've been participating and hadn't seen the services. So I watched them. And when they said the prayers for people that were sick, they didn't say my name. And I asked my rector, who I'm good friends with, I said, I didn't hear my name on Sunday, either Sunday. I said, were you embarrassed that I had COVID? And he said, oh no, I just forgot. So I think recognizing that people that have COVID, even though people can get COVID by possibly being irresponsible in the eyes of others, people can get COVID from just doing their daily jobs, whether it's working as a teacher or a nurse or picking up something at the grocery store for an older neighbor. So I just really hope that we can treat each other with respect and kindness versus any sort of judgment if we know someone that has COVID or is afraid they might have COVID.
No shame, and get tested and communicate. That's
exactly
really important for your health and everyone else's health. That's really good advice. And I thought that was interesting that you said that the symptoms are slightly different for children, and to be very careful about a sore throat, sort of milder symptoms generally. So maybe it'd be helpful to say that again, because we have parents, I'm sure, that are watching the webinar tonight or will watch it later. So the symptoms for children are sore throat. What else, Dr. Baker?
So they're the same symptoms that adults get, a fever over 100.4, runny nose, cough, sneezing, but it also can be sore throat, headache, and even something as common in children as pink eye or red eyes with drainage.
Yeah. So pink eye, I just, that was, when you said that, I wanted to make sure I heard that correctly. So pink eye can be a symptom for children. So that it is presenting a little different there for kids. And so parents are doting already, but continue to watch your children's health. What about different ages of kids, how you talk to them? Like if you had a high school student versus a small child. I think we talked more about a small child. What about a high school student? How would you handle that any differently in how you talk to them about it?
Absolutely. I love my teenagers in the office. I always get excited when I get to see them for a sick visit or a well visit, but they're so different than younger children. I think a lot of teenagers don't volunteer information. So you have to ask them specific questions. I'm always surprised when I ask a teenager a question, whether it's about vaping or sexuality or depression, and they give me a really honest answer. And I always say to them, why did you tell me that? And every one of them says the same thing, because you asked me. So I
very good. That's excellent advice. So don't be afraid to ask parents with your teenagers. Go ahead and say the words, right?
Right. So ask the specific questions was, what about school was awful today? What hasn't been going well with your friends? How are you doing with this? Are you able to sleep and have fun playing video games and enjoy social media, or is everything just not fun for you? I think being aware and looking for signs of depression and anxiety in our kids and our teenagers is very, very important. So.
Yeah. So the anxiety and depression, that's important for kids particularly. And so how would that present with like a small child? I mean, we're going to think about adults having depression and so forth, but is it the same kind of thing? Maybe someone's going to withdraw a little bit, Drew, or are they going to, with a child, how would you begin to think of them as being depressed, disinterested in their normal activities? I mean, I guess nothing's normal right now. Say a little bit about that if you can.
I think it's age specific, like you had mentioned. But I think just being very attuned to looking for anything that's out of the normal for your child or not their usual habit. So maybe they're not eating or sleeping well, or they're having bad dreams, or maybe your super sweet kid is terribly irritable all the time and just incredibly grumpy. So just changes in behavior. Maybe in younger kids and school age kids, kind of having some regressive behavior. So if your child was potty trained, maybe having accidents or not being able to make it to the bathroom in time.
Oh gosh, so potty training can even be symptomatic of some of the anxiety related to this.
And I think sometimes for many of us, when we don't feel well, we get somatic symptoms that are very real to us. So an upset stomach or belly pain, a headache, things like that might make us feel bad can be a sign that we're feeling bad in our heads, in our brains, not just our bodies. So listening out for symptoms of things that might be hurting them or causing them discomfort.
So look out for the little things. The discomfort can be signs of mental health and so forth for children.
Absolutely.
And so they can talk to their pediatrician about that kind of thing. But with adults, we know we go to therapists sometimes and maybe psychiatrists. What's the path for a child?
We have some of the same resources available for children and young adults as well. I think the gatekeeper for that often is, it could be someone like you or me, a clergy person, to meet with the families and to reassure them, and maybe not be the ones to provide the therapy, but to hook them up with the correct resources and get them to people that you can know that can provide the care. And also those providers that take care of your children, we have all sorts of resources. That's what we do. And it hook you up with people in the community that are particularly good with children, family therapy. I have a lot of kids with ADHD. That's one of the things I enjoy taking care of. And one of the 3 approaches to ADHD, aside from medication and physical activity, is therapy or counseling. And some of my families are so resistant when I use the word therapy or counseling. So I love to use the word coaching instead.
Okay.
So talking to kids about, hey, let's get you some coaching to get through this pandemic. And teach you some skills, like we teach you soccer skills. Let's teach you some skills about how to deal with being sad or being stressed. So we're going to get you to the right coach.
So coaching instead of, I think you're right. I think mental health in general, it has a negative stigma, but just say it's time for a little coaching.
Absolutely.
We want to be the best we can be in this time. And as a clergy person, I always tell people, please, no shame. If something bad happens, talk to your doctor, your pastor, and maybe seek some mental health resources as well. Maybe look into therapy, counseling, psychiatric care if necessary. So those are all very important ways to help. Well, so what about the parents, Drew? So I imagine as a working in pediatric medicine, you also kind of care for the parents a little bit. Parents are really stressed out, I'm sure, during this time. What do you have an idea of what you could say to them to kind of give them courage to keep going in the midst of all this? I know it's been a long, long time for them, and they've been struggling too.
It's interesting. When I go into exam rooms, I often have a medical student or a resident with me. And I didn't even notice until several weeks ago, and a student pointed it out, that after I introduce myself these days, I ask how families are doing with the pandemic. So maybe over a year ago, I would have asked them what was going on during the holidays for them, or when their next vacation was. But I think it's important to start out every conversation or many conversations with asking people, how are you doing? And how have things been for you and your family for the pandemic? Adults aren't that different than teenagers. They're not going to particularly volunteer if something isn't going well. So if you can just give them the opportunity and ask the question to give them a chance to respond, that might be all that they need, is a place that's safe, that they can say, things have been really hard for my family. And that's where you as a clergy person, or as a physician, or as a school teacher, or as a neighbor and friend, you can give them that opportunity. You can listen, and then you can support them to get the care that they need.
So trying to support one another, the parents, band together, and as a church, we want to help with that too. And then to encourage people to get the assistance that they need. So on the subject of mental health in children, Drew, I was looking through the chat, and that apparently is a topic that people are interested in. Now, suicidal tendencies in teens, that's always, I guess, a concern, but particularly now, what kinds of things should we look for older pediatric patients?
It goes back to some of the things we had talked about before, changes in behavior, maybe a change in school performance, withdrawing from friends or sports or activities that gave them pleasure before. Sorry about the dog in the background. That's my golden retriever.
Oh my gosh. Well, if he comes on camera, that won't be the worst thing.
So looking just for changes in behavior. And I think being able to, as I've said a couple of times, just ask the teenagers outright, like, how are you doing? How are you feeling? Have you been sad or depressed at all? I think a lot of people don't like to suggest that they feel that it might cause the teenagers to have thoughts or feelings about suicide or harming themselves. And it's the exact opposite. Our teenagers and young adults are just waiting for somebody to give them the opportunity to talk about that. So looking for behaviors that might be different or unusual, differences in sleep or eating, loss of appetite or eating more than usual, but also just being able to ask them and give them a chance to say how things are going for them.
Just talk to them, say, how's it going for you? And watch the changes. And eating habits, that's really good. I think that's important to look for. The children from our church they haven't been back to church for a long time. Is there any advice that you'd give us for getting them ready to come back at some point?
I think it'll be just like with school. It'll be important to tell them what might look differently at church now. That people are going to have their faces covered more than likely.
Okay.
And that families might be sitting far apart from each other and may or may not have the chance to shake hands or hug or share the peace, that there might be new ways to let people know that we are thinking about them and caring about them.
Yeah, there will be definitely some different rituals.
Absolutely. So just kind of explaining what the differences might be. And then after the service, giving them a chance to talk about it. What did you think of church today? How was it different? Did you like it or not so much? And what did you miss? And what are you going to look forward to in the future when things continue to change?
Okay. Well, that's great. That's been some great advice, Drew. I'm thinking also, so how are you doing, my friend, after all this time working and teaching and serving during this pandemic? I reached out to a lot of people, different people, to bring in to provide some help. And I actually reached out to one therapist, and she told me it was fine if I shared this, that she was burned out because of the pandemic. And I wonder about you guys. How are you all holding up with all this going on? And I'm sure the hospital's busier than it's probably been, and concerned parents, so much anxiety out there. How are the medical teams holding up?
People are really tired and really stressed, and honestly, a bit grumpy.
Okay.
Yeah. So I've been playing this little game for the last several months where I ask my medical colleagues and nurses and medical students and residents to think about a positive way that the pandemic has affected them in their lives and their practice of medicine or their family. And honestly, some people can't come up with anything good that COVID has taught them. So because I've been asking this question of other people, I've spent a lot of time thinking about that for myself. And Will, you've known me for a long time, and I'm pretty structured.
Very structured, I would say, yeah.
I used to tell students and residents that a score of 99% in pediatrics caring for children was an F.
I can hear you saying that, Drew. I can. So
that meant that one child didn't get the care that he or she needed. And the pandemic has taught me about flexibility in a way that I never knew that I would learn. And I don't strive for the same perfection that I once did. Instead, I'm just striving for progress. And I just want to do the best that I can with what I have available on that day in that situation. And that's a big change for me. And I also, for me, have been spending a lot of time during the pandemic thinking about kindness. And I haven't talked much about my work as a priest tonight, and sorry I didn't wear the collar.
Oh, I was hoping you'd wear your collar and have your stethoscope too, but that's fine. I'm glad to see you anyway.
But I've been working as a priest associate at St. Paul's Episcopal Church here in Greenville, and I particularly enjoy work with our youth group. And every year our youth group raises money to go to in the summer to Camp Canoga in Hendersonville, North Carolina, and I think that's the equivalent for you Methodists of Lake Junaluska.
Okay.
So in the mountains, it's beautiful, it's wonderful. But this past summer, our youth weren't able to go because of the pandemic. And they heard that Camp Canoga, that's been around for decades, was having financial trouble because of cancellations. So the kids came up with an idea that I thought was brilliant. They decided last fall, during the election time, to sell yard signs, but not the kind that advertise for political candidates. And Will, I sent you a picture of the sign that they've been selling, if you can pull it up.
Yeah, let me see if I can find that.
And the sign says, if you can be anything, be kind. And our youth have sold over almost 200 signs and have donated the proceeds to support Canoga through their financial difficulties.
Can everyone see that now? Is that up, Mayor? If you can.
It's amazing to me.
Yes, it is. And the dog is there.
Perfect.
That's your dog, Drew?
That's my golden retriever, Emmy Joy. But it's been amazing to me that these young people in the middle of a pandemic, they've taken the initiative and time to think about not what they've been missing or lost, but how they can adapt and move forward and care for other people. And I just hope that for each of us tonight, as we continue to work and live and care for our families and friends and communities and others during the pandemic, that the one thing that we can remember is when there's little left to give, the one thing that we can give is kindness.
I think that's, yeah.
Kindness, not just to others, but kindness to ourselves. So I hope that you'll remember the picture of the sign in my front yard and Emmy Joy when you're dealing with all these things in the pandemic that can be so sad and hard and difficult, and just realize that you might not be able to find anything good or be able to articulate anything good that's come from the pandemic or something that you've learned, but you can always, always, always offer kindness to yourself and other people.
I think, Drew, that's an excellent take home tonight for all of us to remember to show kindness and grace, flexibility. Around the church, we're saying agile, mobile, flexible, eligible, because we have to constantly change to meet the new challenges. But show kindness and put that out front. And I'm really thankful for the great advice you've given us, and you've given me some handouts. It's okay if I put that stuff up on the church's website, right?
Absolutely.
So you can look at some answers to these questions and others, and also some resources there. And Dr. Baker, with having both an MDiv and also a medical background, do you have any interest in missions? Because we're a church that's very involved in mission work, and we could always use somebody like you to come along with us. So,
what did I hear about Pender? Is it the 3 Ps?
We say 4 Ps: Philippines, West Virginia, Paraguay, Peru. Am I missing one? Poland. So there are 4 Ps. That's right. So, hey, we'd love to have a guy like you come with us on some of those adventures and those mission trips and ways to serve. So
I would love to reconnect in that way on a mission trip with you and Donna and with the Methodist Church in Virginia, because that's my home.
Yes, indeed.
I'm so grateful to be with you all tonight. This has been wonderful. Thank you for having me.
Thank you so much for coming. And we are going to have another Pender Talk next month on the 24th. So be prepared, guys. If you're watching tonight, come back, we hope, then. And we're going to have Ellen Hart, who is a therapist from Richmond. And we're going to be hearing a little bit about trauma and grief related to the pandemic. So many of us, as Dr. Baker said, have missed funerals, we've missed graduations, our routines have changed, and there's a lot going on inside of each one of us. And so as a therapist, I believe Ellen Hart is going to help us understand a little bit about, understand some ways that we can cope better and release some of what we have been experiencing during this time. Well, thank you again, Dr. Baker, and I'll call you when we sign off here very briefly. But before we go, let's pray together. God, we're so thankful again for those who can help us during these times, and help us, Lord, to be patient and kind during this season that we're in, to take advantage of the mental health, the medical assistance that really this time demands. And so we thank you for doctors to whom we can turn, and others who can help us find ways toward wholeness during this unusual time that we're in. We pray for everyone listening and watching tonight, and we hope, oh God, that you minister and visit them by the power of your Holy Spirit, bringing health in the days that are ahead. All honor and glory is yours, now and forever. Amen.
Amen.
Thanks again, Dr. Drew. And that concludes our webinar for tonight, and we hope you'll join us next month.
Thanks again. Good night.
Yay. Good night, everybody.